Correct labelling, storage and dispensing of medicines is vital to protect the patient against potentially lethal harm. Medication errors in some studies have accounted for up to 30% of medical errors. Safety of medication delivery is thus one of the most pressing issues of the patient safety agenda. In the film, almost everything that could have gone wrong with Jane's medication delivery did go wrong. This chain of events started long before she was administered the wrong drug. Standard operating procedures and guidelines to prevent vincristine being stored with the methotrexate should have been adhered to.
You must be Dr. Robinson. Thanks very much.
Dr. Robinson and Dr. Campbell had never met before. They did not have specific training to be checking these drugs. It should have been the certified nurse that was involved at this level. Traditionally, healthcare workers have worried mainly about the issues of adverse drug reactions, where the patient has been given the right drug but suffers from a side effect. A separate area which concerns itself with ensuring the right standard operating procedures and guidelines are being followed and the right dispensing and delivery systems are being used is known as medication safety practice. This is an important area which examines healthcare systems to try to prevent errors such as that in the film. We all know how bad a doctor's handwriting can be. Yet sometimes the medical notes are the only way that healthcare professionals have to communicate with each other. Therefore, medical records need to be clear and unambiguous. They need to provide an accurate way of conveying important actionable information. It is essential that all hospitals, clinics and treatment centres have established policies for ensuring medication safety. In general, whether we are dealing with vincristine or not, there are certain principles that you may want to consider. For example, all drugs must be clearly labelled and labels must be easily visible. Drugs must be properly checked by the designated person against the patient's medical records and the drug chart. And for high-risk treatments like chemotherapy, drugs must only be given by nurses and doctors with specialised registered training. For your organisation, ask yourself the following questions. Are medical notes easily accessible, kept regularly up to date and easily legible? Do your procurement policies ensure consistency of drug purchasing and checking mechanisms to detect potential errors such as look-alike and sound-alike medications? And finally, do you have systems in place to ensure only those properly trained are able to be involved in the delivery of high-risk drugs?